The work of a medical laboratory technician is exciting, varied and vital to the quality of a patient's healthcare. Medical lab technicians, also referred to as MLTs, medical laboratory scientists, technologists or clinical laboratory science professionals, work behind the scenes as highly skilled scientists, performing tests that detect the absence or presence of disease. Results of the tests performed by these scientists are passed on to physicians so that they can treat patients and manage disease according to the findings. Laboratory tests ordered for the patients are based on recommendations from doctors and other healthcare providers. Lab technicians usually have no direct interaction with the patients, but rather perform tests on human bodily fluids, tissue samples and cells collected by nurses or other healthcare professionals to determine diagnoses and identify abnormalities. Technicians work with microscopes, computers and other automated laboratory equipment, keeping detailed records of the data they compile. The duties of a medical laboratory technician can be general in nature or specialized in areas such as immunology, microbiology and clinical chemistry. Both specialized and general roles are important for the medical field as the results of their testing help physicians to accurately diagnose and treat cancer, heart disease, diabetes and other serious health conditions. These tests can also be used for the prevention and management of disease. Workplace details: about half of medical laboratory technicians work in hospitals, while the rest work in specialized medical or diagnostic laboratories, in physician and dentist offices, and in state or federal agencies. Some of the work can involve contact with infectious materials or hazardous agents, but technicians are always properly trained and protected, wearing goggles, gloves or masks for much of their workday. Safety training occurs regularly to prevent accidents. The work hours provide a great degree of flexibility because most facilities require medical laboratory technicians on staff 24 hours a day. Hours may be normal business hours, evenings, nights, weekends, and some holidays, as needed by the hospitals and other 24-hour facilities. Hover over any state to explore local income and job growth data. Created with Raphael 2.1.0 LAK as RCACOCT to DCFL GAHI IDLNEA KS KYLAMEMDMAMEMNMS MOMTNANVNHNJNMNYNCNDOOKORPA RES CSDTNTXUTVTVAYWVY. According to the Bureau of Labor Statistics, the median annual wage for medical laboratory technicians is $38,970, while for a medical laboratory technologist it is $60,520. Outpatient facilities pay the highest, followed by hospitals, physician offices, and medical and diagnostic laboratories. The job outlook for MLTs is positive. According to the Bureau of Labor Statistics, medical laboratory technician employment is projected to grow by 18% between 2014 and 2024, which is much faster than the average job growth. The picture is similarly promising for medical lab technologists, who will see jobs grow by 14% during that same period. This predicted increase is due to the anticipated healthcare needs of the aging U.S. population, which will require laboratory testing for conditions such as diabetes and cancer. In addition, it is expected that workers with experience in a number of specialties will have the greatest chance for employment. To hold the title of a medical laboratory technician or a clinical laboratory technician, a 2-year associate degree is required. A job with the title medical laboratory scientist, technologist requires a bachelor's degree. Candidates must obtain this education through a program accredited by the American Society for Clinical Laboratory Science, ASCLS. Programs are available all over the country and are specific to the degree desired. The courses in these programs tend to be science-oriented, focusing on general laboratory knowledge. Finding an accredited program is beneficial for better job opportunities, and the National Accrediting Agency for Clinical Laboratory Sciences has a list of accredited educational programs. Show Me Schools note that if you already have an associate or bachelor's degree, you may be able to enroll in a certificate program through a university rather than obtaining an additional degree. After you have attained training in the classroom, a medical laboratory technologist or senior technician will provide on-the-job training to you. In some cases, a healthcare or medical professional is the primary trainer. Duration of training depends on the employer's policies and a technician's previous experience. National certification isn't universally required, though some states do require it for licensure. Even in states that do not require certification or licensure, getting certified will help you get a job. Many employers require their lab employees to be certified, while others show a strong preference for hiring certified technicians. Several organizations certify MLTs. To determine which ones make sense for you, check your state licensing requirements and also the preferences of local employers. MLT certifying organizations include technicians keep their certification current by taking advantage of continuing education classes, available through professional associations or employers. Most states, medical laboratory technicians must have a license or be registered to work. Licensure often involves passing an exam or undergoing a certification process. Sometimes an internship or trainee position is required before obtaining a license.